Hey, it's Chris with Rowe Dental Laboratory, and we've put together a series of videos on the restorative workflow for full arch. There's a bunch of different ways to do this. It can be very confusing at times, but we've tried to make this nice and simple in this video series. We're covering analog workflows and the various digital workflows. In this particular video, we are covering how to go from a transitional or your immediate load prosthesis to a final using a duplicate prosthesis that was picked up the day of surgery on a stackable guided system. Now here at Rowe Dental Laboratory, we have the patented Chrome Guided Smile. It's an industry-leading full arch stackable guided system, and we have a duplicate prosthesis called the Rapid Appliance. We call it the Rapid Appliance because it speeds up the transition from your immediate load prosthesis to the final. It saves appointments, but the key to it is picking up, of course, your day of surgery. You have your immediate load prosthesis that you pick up temp cylinders in, and then we send a duplicate of that. They're both very pretty prosthesis, and actually, if for some reason this breaks or something happens to this, you can always seat the Rapid Appliance as well. It's a very strong material that we make and send with Chrome Guided Smile. But you do a second pickup of temp cylinders in the Rapid Appliance, and you're just going to hold on to this for 4 to 6 months. Send the patient home. They come back to you. Now the restorative workflow is going to kick in, and this is where the time savings happens on the duplicate prosthesis with these stackable guided systems out there. Patient is wearing their immediate load. You've dialed the bite in perfectly with this. They love how this feels. You want to make a printed shrine or a transitional to the final zirconia based on this bite, this vertical, these records. So what we are asking you to do, you're going to scan us the opposing, scan the bite, and then unscrew this existing prosthesis and scan their healed tissue. Send those records to the lab. You're going to physically send the Rapid Appliance to us, and then get that to us, and we're going to make a prototype for the final from these records. In the meantime, you take your Rapid Appliance, and because you pick this up the day of surgery on your stackable guided system, it's perfectly indexed. So we have a passive seat, and it's picked up at the right vertical because again it was picked up on the stackable system the day of surgery. So this is going to seat perfectly on your multi-unit abutments. You're going to want to dial the bite in a little bit. Get that occlusion comfortable. The patient's not going to love it because you sent away what they've been wearing, and again, that's the best way to do it because we want to make the perfect prosthesis for the final using those records. Seat the Rapid Appliance, get them comfortable, send them on their way, and then in a few days we're going to send you back our printed try-in for you to dial in some records there, and then we go to final. So 2 appointments there, printed try-in, final zirconia. Every once in a while, we have the ability to go right from the Rapid Appliance appointment to your final zirconia. It just all depends on the patient and the tissue adaptation and all that. So along with those records you send us, please, please, please give us a nice photo. We want a full face, full smile photo of the patient wearing their prosthesis. Ideally, again, straight on, doesn't have to be a fancy camera, just be your smartphone, but a nice straight on photo of them smiling, and give us an exaggerated smile as well. Those photos help a ton when designing these prostheses. If you have any questions, give us a shout here at the lab. We'd love to help you out. You can leave some comments in the section below and we'll get right back to you. And also, please check out our website. We have a bunch of videos covering the different content on restorative workflows and all different kinds of workflows here at the lab. Thank you.